Hi there. Today I'm going to be talking about hair transplantation for patients other than those that have the typical male or female pattern hair loss. As many of you are probably aware, most patients see hair transplant surgeons for either male pattern hair loss or female pattern hair loss. This is about 90 to 95% of the patients that we see. But if you're watching this video, you most likely have some other type of hair loss. You may have alopecia areata, lichen planopilaris, frontal fibrosing alopecia. Also, there's a trichotillomania or other types of scarring alopecias as well. And so you may ask yourself, can I do surgery? Can I have surgery? You may have already seen your dermatologist for these other diseases, and there's a large area that has no hair, and you want to know. Of course, your hair loss surgeon can be your best benefit to visit and see if you are indeed a candidate, but in general, on occasion, we can and do treat these patients. Now, each type of hair loss has a different course of, you may be treating with medications, there may be other phases that need to look into. But for example, let's go over someone that perhaps had alopecia areata. Now, this is a hair loss that you may have heard of. It's been on the news quite recently. Patients have spots, bald spots that occur. Sometimes it occurs during stress, sometimes out of the blue. Oftentimes it comes and goes. So in general, the hair loss pattern develops, stress goes away, it goes, and then the hair returns. Oftentimes dermatologists have to treat you with steroid injections, those types of things. But sometimes the hair doesn't come back. Sometimes those spots remain, and you want to know if you can do transplantation to those areas. So when we would see you in consultation, we would always discuss with you how long has it been, how often does it recur. We get a feel for if this is a disease process that most likely would recur. As I mentioned to, it's unknown. A lot of these hair loss patterns and processes are very mysterious, let's put it that way. And so we're not always sure if they will recur or not. So if you were really determined and you really wanted to do the surgery, what we typically would do is we'd want to make sure that the hair loss hasn't come back within a year or two, make sure that we call it stable, nothing's happened. Also, a good thing to do would be perhaps to get a biopsy or a small test of that area where you had that loss to see if there's indeed some activity that's going on that we just can't see with our naked eyes. That would be another thing. Now, once we know that nothing's happening, it's stable, we would still, of course, talk to you and say, now, there's always a potential it could come back. Are you willing to take this risk of doing surgery? And if you're still okay to do it, then we'd go to the next step, which could be one of two things. One is we dive straight into surgery as normal, as if it would never come back. Or we could actually do what's called a test surgery, where we do 100 or 200 grafts, which is not a lot, and we would put those into the area of baldness and see how they grow, see how they take for a year or two, and to give you a little more comfort that those grafts will grow well and that you'll have some longevity with it. Now, if you do all this and everything grows, you still have to be prepared that over time you may lose hair due to the hair loss process. Now, it is a gamble, but for many patients the gamble is worth it. To have hair for a number of years, especially when you're younger, is often quite an important thing for some patients. So I encourage you to seek help, to seek a consultation from a hair restoration surgeon, because you may indeed be a candidate for surgery with these other types of hair loss patterns. Thank you. Take care.